with that, speaking of China, 3 years after COVID-19 was detected in Wuhan and just a week after China made changes to its rigid zero COVID policy, COVID has reared its ugly head once again. Shops, restaurants, streets have been left empty, and for a place that until earlier this month assiduously tracked every case, there is now no clear data on the extent of the virus's spread. China's new COVID rules significantly roll back the testing requirements that once dominated daily life, and residents have now instead shifted to using antigen tests at home when available, leaving official numbers unreliable. China is also setting up more ICUs and trying to strengthen hospitals in the wake of the surge and the lack of a zero COVID policy to fall back on. CNN's Selena Wong gets us a look at life in Beijing as China exits its zero COVID policy.
COVID lockdowns are finally over in China, but the irony is that here in Beijing, it still feels like we're stuck in one. Streets are empty, many stores are closed, businesses are struggling to stay open because so many people have COVID. It's spreading extremely fast here in Beijing, and authorities say it's spreading rapidly across the country, but we don't know just how fast. Authorities said they've given up on counting all cases, since there's no way to gauge the number of infections now with people avoiding official tests and staying at home. Here in Beijing, the number of patients going to fever clinics jumped 16 times this Sunday compared to a week before. Authorities also said the number of calls to the emergency hotline have jumped 6 times. So here in China, there isn't a strong primary care system. So it's common to rush to the hospital even for minor illnesses. So it's no surprise we're already seeing long lines forming outside of hospitals. Authorities are now scrambling to increase the number of fever clinics and ICU wards, pledging as well to boost the lagging vaccination rate for the elderly population.